Hello everyone, now let us discuss about the scheme and syllabus for recruitment to the post of drug inspector in Drug Control Administration Department. Now let us discuss the scheme of the examination or paper pattern. There will be two papers, paper 1 and paper 2, and there will be objective type questions. For paper 1, it indicates general studies and general abilities. Number of questions are 150, duration of minutes is 150, maximum marks allotted is 150. And for paper 2, it is concerned regarding the subject at degree level. Number of questions will be 150, duration will be 150, marks allotted will be 300. That is, each question carries 2 marks. So total marks will be 450. Now coming to the language of examination. Paper 1 will be bilingual. It will be in English and Telugu. Whereas paper 2 will be English only. Now coming to syllabus of general studies and general abilities. It includes current affairs, regional, national and international relations and events, general science, Indian achievements in science and technology, environmental issues, disaster management, prevention and mitigation strategies, economic and social development of India and Telangana, physical, social, economical geography of India, physical, social, economical geography and demography of Telangana, socio-economical, political and cultural history of modern India with special emphasis on Indian national movement. And socio-economical, political and cultural history of Telangana with special emphasis on Telangana statehood movement and formation of Telangana state, Indian constitution, Indian political system, governance and public policy, social exclusion, rights issued such as gender, caste, tribe, disability, etc. and inclusive policies, society, culture, heritage, arts and literature of Telangana, policies of Telangana state, logical reasoning, which contains analytical ability and data interpretation and basic English, that is 10th class standard. Now coming to paper 2, syllabus for paper 2, that is concerned subject. Importance of various pharmacopoeias with special reference to Indian pharmacopoeia, British pharmacopoeia, United States pharmacopoeia and international pharmacopoeia. Sources of drugs such as plant, animal, mineral, synthetic and biotechnological drugs. Preparation of infusions, decoctions, tinctures, solutions, soft and dry extract. Introduction and classification of various pharmaceutical dosage forms. Various parts of prescription handling, handling of prescriptions, preliminary knowledge of important Latin terms, useful in the interpretation of prescription and their translation into English. Posology, which includes the calculation of dosage for infants, children, adults and elderly person, alcohol dilutions, proof spirit, isotonic solutions and displacement value. Brief outline of communicable diseases, their causative agents, mode of transmission and their prevention. For example, chickenpox, tuberculosis, malaria, filaria, leprosy, sexually transmitted diseases and AIDS. And first aid, which includes emergency treatment of shock, snake bites, burns, poisoning and fractures. Classification of microbes, their structure and identification, bacterial growth, nutritional requirements and staining, contamination of pharmaceuticals in hospital and community environments by microbes, sterilization, definition, types, procedures and testing, sterilization of materials, equipments and utensils used in hospitals, centralized and decentralized sterilizations, drug distribution systems in hospitals for outpatient, inpatient and unit dose dispensing systems, hospital acquired infections and infection control programs, biomedical waste management, ophthalmic preparations, formulations, methods of preparations, containers and evaluations, collection, processing, storage and evaluation of blood products and plasma substitutes, surgical products such as surgical cotton, surgical gauze, bandages, sutures, ligatures and catgut, and definition and types of incompatibilities such as physical, chemical and therapeutic, and correction of incompatibilities, anatomy and physiology of cardiovascular system and related common disorders like hypertension, angina, myocardial infarction and congestive heart failure, Anatomy and physiology of digestive system and related disorders like peptic ulcers, constipation, diarrhea, jaundice, and drugs acting on gastrointestinal tract. For example, antacids, anti-ulcers, anti-emetic, laxative, anti-diarrheal, and probiotics. And functions of different parts of brain and spinal cord, neurohumoral transmission in the central nervous system and autonomic nervous system, drugs acting on cardiovascular system, digitalis and other cardiac glycosides, antihypertensive drugs, anti-anginal, vasodilators including calcium channel blockers. Next, drugs acting on central nervous system, sedative, hypnotics, anti-anxietic agents, centrally acting muscle relaxants, anti-epileptics, analgesics, antipyretics and anti-inflammatory drugs, antigens, antigen-antibody reactions, hypersensitivity, active and passive immunity, types of vaccines, monoclonal antibodies and their clinical applications, and historical development of antibiotics, isolation of fermentation products with special reference to penicillins and tetracyclines, carbohydrate metabolism, which includes glycolysis, glycogenesis, glycogenolysis, glycogen formation, pentose phosphate pathway, uronic acid pathway, abnormalities of carbohydrate metabolism, introduction and principles of antimicrobial therapy, cotrimoxazole, fluoroquinolones, newer penicillins, broad-spectrum antibiotics, cephalosporins, macrolides, antitubercular, antileprotic, antifungal and antiviral drugs, anti-protozoan and anti-helminthic drugs, chemotherapy of neoplastic diseases, and also salient features of Drugs and Cosmetic Acts 1940 and 1945 with special reference to duties and powers of inspectors, composition and functions of statutory bodies, Narcotic Drugs and Psychotropic Drugs Act 1985 with special reference to procurement and utilization of dosage forms, GMP and CGMP and their salient features, regulatory aspects concerning the medical devices. These are the various topics that must be covered in paper 2. Thank you for watching. Please subscribe for further videos on pharmacology and other related pharmaceutical sciences.